We're joined now by Dr. Ashok Rai, President and CEO of Prevea Health. First of all, Dr. Rai, thank you for joining us this evening.
Thanks for having me.
This past 12 months have been memorable, good or bad. It's definitely been memorable in our history books. And I want to talk about how things have changed in healthcare over the last year.
I don't think any of us in healthcare could have ever imagined what we've gone through as a country and as a profession. Change is everywhere. How we think about patient care is completely changed. Generally, healthcare is designed around the patient that's in front of you that day. And all of a sudden, you're looking at disease spreading so fast, and you go away from just focusing on an individual patient to focusing on a community. And while seeing some of the greatest trauma that you've ever experienced. So our profession and how we handle death, we thought we were pretty good at it. We were trained for it. But at this level of what we've experienced and what we've seen nationally, locally, it's something that it's probably going to take a generation or two for us to truly get through and figure out how we will do better next time.
What have been some of the biggest challenges in healthcare over the last year?
In the beginning, it was great. All of a sudden you're everybody's hero, and we didn't really want to be heroes. It's not why we went in this profession, but everybody's like clapping for healthcare. And then somewhere along the line, a switch got flipped, and it was really difficult because all of a sudden our recommendations, we've been trained as scientists since the day we were in undergrad, and we went to our chemistry classes and we learned scientific methodology, and all of a sudden all that was being in doubt by people who had never done our job. And all of a sudden things coming out of our mouth or what our recommendations were causing political controversy, public controversy, splitting up families in arguments and school boards. It was really something I don't think we ever expected when we go into this profession.
We've been talking about what's been happening over the last 12 months. Now let's talk about what you've learned in healthcare moving forward.
We've learned a lot. I think probably we've learned that anything is possible if you put your mind to it. And we've learned that teamwork is completely redefined, that great people will do incredible things in a time of crisis. And interesting friendships are made during that process. Competitors become colleagues, all in the best interest of the community. We've learned that our scientific process can be incredible when it's focused. Look at what we've been able to do in vaccines. Now think about taking that last year of focus and saying, all right, cancer's next, HIV's next, diabetes is next. We've proven in the last 12 months, and we put our mind to something and put the money and the resources that we need to do something, we can create incredible results. So this is a dawn of a revolution in healthcare of what we can expect from the scientific community around disease-specific treatments and cures.